Hello, I'm Dr. Margaret Kyrkou, the General Practitioner at My Therapy House. I originally trained as a general practitioner working in a medical practice, but now work in the developmental disability field by choice. I have an adult daughter with autism, so I have a unique understanding of the issues informed both from medical and family perspectives. As medical professionals during their training have vast amounts of information to cover, developmental disability tends to be a very small component for many doctors. Their knowledge and understanding of disability is more likely to come from personal experience, or they may be the lucky few who work in the disability field. Research, particularly in the field of genetics, is reducing the number of times the parents of a child with disability are told, "We know your child has disability, but we don't yet know what caused it." The ever-increasing number of conditions causing disability being diagnosed means only a handful of doctors have all the information about every disability at their fingertips. For most of us as doctors, it means getting detailed information at the time of the child with disability attending, but the information is not always readily accessible. Parents have often researched their child's disability thoroughly, so it is helpful when they bring in that information to show me. Not all doctors are comfortable with a child with disability, particularly as the child gets older and bigger, or the mobile child is touching, or destroying, as the case may be, equipment in the consulting room. Some doctors will observe the way the family interact with the child and be willing to gradually get to know the child, but for others it is obvious that the doctor is not going to be comfortable relating to the child. It doesn't make that doctor a bad doctor, it's just not his or her area of interest. I find that children with or without disability seeing a doctor for the first time are hesitant about what is going to happen. Observing the child, avoiding going too close to the child and only touching when medically necessary on the first visit reduces the anxiety for future visits. Parents can also make the first visit positive by not pushing the child to be examined if not medically necessary. Where it is medically necessary, a child with or without disability can be examined in such a way that the child just thinks it's a bit of fun. I remember seeing a doctor examining a child in such a way that the casual observer would think the child was just being tickled. The child was laughing, which relaxed his tummy, and the doctor was able to check everything necessary without the child getting distressed. Children who have had bad experiences in a hospital are often frightened of white coats. Most doctors in the community do not wear white coats, but it is something to be aware of. Discuss with the doctor whether or not it would be wise to not give injections or take blood in the surgery, as children can become frightened to go to the surgery again. Many parents of children with autism struggle to get their child into a GP or paediatrician's consulting room, particularly children with autism. It may be because it's a new environment, has strong smells, waiting is difficult in a noisy area with a lot of people talking, or the child remembers being held down to be examined or given an injection. Some ways of reducing anxiety for the child are to ask if there is a quiet area where the child can wait, arranging to stay in the car until the doctor is ready to see the child, and taking a favourite toy or the child's iPad to keep him or her occupied. When I know the doctor might be running late, I ring just before to check if we should arrive on time or later. I have walked around just outside the consulting room until called, pushed the stroller or wheelchair around, or pushed the rocking horse until another child claimed it, then watched to see when it was free again. It can be difficult for families when advocating for their child with disability to know what information the medical professional needs, while still being able to identify the priorities for their family to maintain quality of life for all. In my experience, many families of children with disability have carefully kept all medical reports and information, so it is important to select what to take to the doctor's appointment. If you already have a regular family doctor whom you feel comfortable with, it is sometimes easiest on the first visit with your child with disability to be upfront and ask if he or she is happy to see your child or thinks an alternative doctor would be better. This signals to the doctor that you realise not all doctors have the same medical interest and that he or she will do what is in the best interest of your child. When seeing a doctor for the first time, it is useful to take the child's blue book if the child has one and information has been recorded. Also information about the child's disability and diagnosis, doctors or other professionals the child has seen, and results of any investigations. Although I am a fully qualified GP, my work at My Therapy House is in relation to the child's disability, not health checks and managing illness. I help families understand their child's disability, particularly when a child has autism. Common issues are eating, sleeping, toileting, behaviour issues and concerns for siblings. Parents seem to be getting increasing numbers of time-consuming forms needing to be filled out by the parent or guardian and a medical practitioner, such as carer's allowance, national disability insurance forms, companion card, disability parking, mobility allowance and disability support pension. I am able to explain what is required in the parent section and complete the medical section, often while the child is having therapy. I bulk bill for medical services as I understand the financial and emotional pressures on families where there are one or more children with disability. Thank you.